To protect our most vulnerable, caregiver backgrounds need to be checked efficiently, effectively, and quickly within each state and often across state lines. This is why the National Background Check Program is so important. Some states have seen the value of sharing the National Background Check Program process and system with other agencies within their state. This is Florida's story.
The concept for a clearinghouse has actually been around for many years. We used to get complaints from a lot of our providers and individuals being screened about the multiple screenings that they had to have done and the cost of those screenings. When researching, we realized that a lot of the screenings that were being done actually were very similar in process or standards to other state agencies. The realization of the clearinghouse happened after a major legislation change in 2010, and then a request by the governor's office to better background screening by creating an interagency work group with the health and human service agencies that process background screening for employees working with the vulnerable population. The first step in creating the clearinghouse was the interagency work group's report to the governor's office that detailed the cost and time savings that the clearinghouse would create by the sharing of screenings. At the same time, ACA was awarded the National Background Check Program grant with the goal of working closely with state law enforcement and health and human service agencies to enhance technology, reduce duplicative screenings, and implement a RATBAC program. The next step was receiving FBI's approval for the sharing of screenings.
FDLE petitioned the FBI using the premise that each agency had the same purpose, which was serving vulnerable populations, and thus the screenings fell under the National Child Protection Act.
Once the governor's office was on board and the FBI approved, the next step was getting the support from the other agencies and providers. This was done by showing the cost and time savings that the sharing of screenings would create, along with the safety of the vulnerable population that the RATBAC program would accomplish. Another step in the implementation of the clearinghouse was the writing and passing of legislation. This included the requirements to have a clearinghouse screening, which included a photo taken at the time of screening, the retention of fingerprints, and a signed privacy policy by the individual, along with a rescreening schedule for those that already had fingerprints that were good for 5 years.
We worked with the specified agencies to prepare legislation that met the statutory requirements based on the guidance outlined by the FBI.
Implementation of the clearinghouse was not as easy as expected. One of the biggest obstacles was figuring out a timeline for bringing on the other agencies. We decided to go with the Department of Health first because there was the most crossover in screenings for them and for us. In bringing on the other agencies, it was really decided based on legislation or the funds to be able to connect to the system.
The Florida Department of Law Enforcement did have a role within the implementation of the clearinghouse. FDLE was part of the interagency work group. We petitioned the FBI to allow the agencies to share screenings.
One of the things that we didn't prepare for is the time it takes for implementation of each agency into the system. To bring one agency on, it can take 6 months up to 1 year, and that all includes requirements, development, and training of those agencies.
FDLE had several responsibilities during implementation of the clearinghouse. We provided guidance during the system design process to ensure that the system was in compliance with all CJIS security requirements and that information was disseminated appropriately and access was maintained to authorized users.
The main features of the clearinghouse are the ability to share screenings with other agencies. A screening can be shared up to 7 times if there are providers from each agency that are interested in that individual. Other features of the clearinghouse are the ability to be able to track a screening through its entire process. Providers receive notification emails of each step of the way of the process, and they also can receive a copy of the Florida Public Rap Sheet of the individual that they are interested in hiring. Another feature of the clearinghouse is the ability to connect to LiveScan service providers across the state and actually capture appointment information within the system. One of the other requirements of the clearinghouse is for the providers to maintain an employee roster, and that can be maintained within the clearinghouse. The biggest feature of the clearinghouse is the ability for the employer to receive an arrest hit notification almost immediately after an employee is arrested.
FDLE expanded state RATBAC to include applicants from each specified agency. We have an interface with the clearinghouse that allows for the renewal or cancellation of RATBAC. Currently, we are working with the FBI to implement national RATBAC. We are testing it this time and expect to be operational by mid-2017.
The clearinghouse has proven to be a major cost savings for the state, along with ensuring that the vulnerable population is tended to by only those that are eligible to care for them. Since implementation in 2013, the clearinghouse has processed 1.5 million screenings. Healthcare providers and licensees have collectively saved $14.4 million. While cost savings are beneficial, the most important part of the clearinghouse is protecting the vulnerable population. Through the RATBAC program, we have received over 45,000 people that have been arrested after they have been screened. Of those, 30% went from eligible to work with the vulnerable population to not eligible for offenses including grand theft, battery, and even exploitation of the elderly. An example of this is the second RATBAC we actually received was for an individual that had an exploitation of elderly arrest. She had actually just been hired to work at an assisted living facility and had called and said she was going to be late for her first day. Well, at the same time, the facility received the notification letting them know there was an arrest. They went online, saw the arrest information, and called us and thanked us so much because they believed her that she had a family emergency and that she was going to be at work, but actually she had been arrested for a very serious offense. The biggest recommendation I can give to states interested in creating a clearinghouse program is to have a great working relationship with your state law enforcement. The clearinghouse wouldn't have been nearly as successful without the Florida Department of Law Enforcement's support and assistance.
Implementing a system such as the clearinghouse, which is a very large system, requires a collaborative effort, and we thoroughly enjoyed working with members of the Agency for Healthcare Administration as well as members of the other 6 specified agencies.
The concept of a clearinghouse and the ability to share screenings among state agencies is efficient and effective. I highly recommend a background screening program nationally for the protection of those that cannot protect themselves.